So here's a question that sounds really simple on the surface, but it's actually incredibly complex. How do you measure the health of an entire community, a city, or even a country? And this isn't just for fun. The answer drives policy, it drives funding, and has a huge impact on people's lives. So how do we measure something we can't really see?
I mean, really, it all boils down to this. If I asked you right now, how healthy is your community? Where would you even start? It's a massive question, and getting the answer right has some pretty big consequences. And right away, we hit the main problem. You know, unlike taking someone's temperature, there's just no single thermometer you can stick into a city to get a reading. Health is this big, messy mix of physical well-being, mental health, social factors. It's not just one number. So how in the world do public health experts measure it?
Well, they do it by using some really clever tools that act like clues that help us see what's really going on and start measuring the invisible. And the hero of our story today is what's called a health indicator. The World Health Organization puts it pretty simply. It's a variable that helps us track changes when we can't measure something directly. Think of it like seeing footprints in the sand. You don't see the person, but those prints tell you a ton, that someone was there, which way they were headed, maybe even how fast they were moving. Health indicators are basically the footprints of a community's well-being. Okay, a quick but super important point here. We have to know the difference between an indicator and an index. An indicator is just one single measurement, like the infant mortality rate. But to get a bigger picture, we often bundle a few indicators together into an index. So an indicator is one piece of the puzzle, while an index is a score that combines a bunch of those pieces.
But, not all footprints are created equal, right? Some are deep and clear, others are kind of smudged. The same exact thing is true for indicators. There's actually a whole checklist for what makes one really, really good.
So, for an indicator to be considered ideal, it's got to check a bunch of boxes. It has to be valid, meaning it actually measures the thing it claims to measure. It needs to be reliable, so you get consistent results over time. You want it to be sensitive, so it can pick up on even small changes, but also specific, so it isn't being influenced by a bunch of other random factors. And of course, it has to be feasible. You actually have to be able to collect the data and relevant to what you're trying to understand. Now, finding one indicator that aces all 6 of these, that's the dream, but it's really, really rare. And this brings us to probably the most important point. You can never rely on just one indicator. Think about it like your car's dashboard. Your speedometer tells you how fast you're going, sure, but it tells you absolutely nothing about how much gas you have or if the engine is overheating. To really know if your car is okay, you need all of those gauges working together. It is the exact same idea for community health. All right, so what's on this public health dashboard? Let's go ahead and open up the toolbox and see what kinds of indicators we're actually working with. To make sense of the dozens of indicators out there, it helps to sort them into 3 main trays. The first tray is all about measuring life and death. We call this mortality. The second is about sickness and well-being, morbidity. And the third tray zooms out to look at the big picture, the system and the society that shape our health every single day. Let's start with a classic from that first tray, life expectancy. This number tells us, on average, how long a newborn can expect to live if things stay the way they are now. Generally speaking, a higher number means better health and living conditions. It's a really powerful big picture summary. Now, in contrast to a broad number like life expectancy, the infant mortality rate, or IMR, is an incredibly sensitive indicator. Because babies are so vulnerable, this one number tells you so much about a whole range of things: the mother's health, sanitation, access to doctors, you name it. A tiny shift in the IMR can signal some really big things happening in a community. Okay, let's move to our second tray, measuring sickness, or morbidity. And this is where we run into a huge challenge. The data we have on illness, the number of hospital visits or confirmed cases, is almost always just the tip of the iceberg. What we see is the small bit floating above the water. But underneath, there's this massive, invisible chunk of undiagnosed or unreported cases. It's a major blind spot.
And finally, our third tray. This is where we zoom out and remember that health doesn't just happen in a vacuum. We use indicators to measure the world around us. Things like how many doctors are there for every 1,000 people, what percentage of the population has safe drinking water, or even the female literacy rate. Believe it or not, that's a powerful health indicator. Even a country's health budget tells us a story about its commitment to well-being. So we have all this data, all these indicators. What's the point? This is where we see these numbers jump off the spreadsheet and into real-world global action. Because they're not just for writing reports, they are designed to actually drive change. Over the last couple of decades, the global community has been using these very tools to set huge health targets. It really got going with the Millennium Development Goals back in 2000, and that's evolved into the even bigger Sustainable Development Goals, or SDGs, that we have today. The entire game plan for these goals is built on indicators. I mean, just look at this target from the SDGs. It's not just a vague wish, right? It's a specific, measurable goal. And how do we know if we're on track to hit it? By tracking indicators like the infant mortality rate and the under 5 mortality rate. The indicator literally becomes the yardstick we use to measure success. And that right there is why this all matters so much. Indicators take this fuzzy idea of health and turn it into something real, something we can measure, track, and hopefully improve. They give us a starting line, help us set finish lines, and ultimately, they allow us to hold our leaders accountable for getting results. So, after looking at all these different tools and how they're used, what's the big takeaway? How should we really be thinking about all of this? It really all comes back to that car dashboard. A community's health is way too complex to be captured by a single magic number. There's just no such thing. You need that full profile, a whole dashboard of indicators, looking at life, death, sickness, society, all viewed together. That is the only way you're ever going to get a true picture of what's going on. And that kind of leaves us with one final thought for you to chew on. If you were going to build a health dashboard for your own community, what indicators would you put on it? What story would those numbers tell about the place where you live? Something to think about. Thanks so much for joining me.